All right, folks, let's go ahead and get into our muscle list. So your muscle list is going to be focused on different groups of muscles. The first I'm going to focus on is the muscles of the head, neck, and the trunk. And remember, on your list, the muscles are ones that are involved. You need to learn the origin, insertion, function, and location of. While the muscles that are not involved, you just need to be able to locate. Okay, folks? So here's two images for the four muscles we're going to focus on. It shows all four muscles in this image, but I'm also going to be showing you these muscles in the app that I usually use, same one I use for the skeletal system. You can also go ahead and check off muscles as we go along, but remember to try your best to use the naming tips to help you locate and understand the function of the muscle, meaning its action, or the size and shape, etc. So my way of organizing myself is just saying, okay, let's go ahead and start with each four of these muscles. I'm going to look at their names to help me kind of remember the location of them. If the name can give me details about the location, if not, I need to look at something else, like just look at the models, for example. So let's go ahead and start in general with the temporalis muscle. So as you can see, the temporalis is here, and you also see temporalis here. So here's our temporalis muscle, and we're seeing right here, okay? Now, if you want to go focus on origin and insertion, you can, okay? But also, because I know we have to focus on location, I want to think temporalis is around the temporal bone of the skull, okay? So that's going to give me a region of where the temporalis muscle is. You can also say, okay, well, the origin is the temporal fossa if you want it, or the insertion is going to be the mandible. Okay, you can do that as well. But what's the whole purpose of the temporalis muscle? It's going to be there to help you close your mouth or retract your jaw. So remember, to retract your jaw, you're going to basically have your lower teeth touch the upper lip. So I have my lower teeth touching my upper lip, and I am retracting the jaw. The temporalis does that. If I'm going to close my mouth, the temporalis is going to help with that. If I need to know the location of this temporalis muscle, again, the name itself tells me the region, the temporal region of the actual skull. So I know my temporalis is right in that region. All right, so we got done with temporalis. Now let's focus on the masseter muscle. So you can see the masseter muscle here. Okay, masseter. And we're talking about origin and insertion. Remember, we're talking about the part that's going to be stable and then the part that's going to be mobile. So I'm looking at my masseter muscle. As you can see, the masseter itself is going to be helping with what? Mastication, which means chewing. So it's going to be helping with chewing, and it's going to be including your jaw. So you have to be able to move that mandible in some kind of way. So that means my origin must be here up by the zygomatic arch, and then my insertion must be the mandible, because that's going to be where I'm going to be moving to cause chewing. So you can say that the masseter is located on your cheek/jaw. And what does the masseter do? Again, it's a part of mastication. That's how we get that name. And it's going to help us be able to have a strong bite when we bite down on something. Okay, so we got the location of temporalis around the temporal region. The masseter, we know it has to do with mastication. So either or, we know it's going to be a part of the lower jaw. Okay, and also its origin could be around the zygomatic bone or zygomatic arch. Do you have to know the details of the origin and insertion? No. But sometimes, again, understanding where the origin and insertion is can help you locate it. So it just depends on how you want to remember it. I'm not going to be going through every single origin and location for the things that we don't have to go into those details for. But I'm just saying, if you know the origin and insertion area, it can help you understand the location. Now let's go ahead and get to the frontalis muscle. Frontalis is also called the frontal belly. And as you can see, that's going to be the muscle here that's on your forehead. So it looks like it's going to be on your forehead, and also going to be right there on the brow ridge area. And here we go. And what does the frontalis muscle or frontal belly do? Well, it's going to be able to raise your eyebrows and also wrinkle your forehead. So if you go ahead and raise your eyebrows and you kind of wrinkle your forehead, you're using your frontalis muscle. How can we figure out the location? Well, frontal is going to be around the frontal bone, right? That can help you remember that that's where the frontal belly or frontalis is going to be. So remember, all the ones we're checking off, we need to focus on where the locations are on these models. Now, next we have the orbicularis oris, and that's going to be here around the mouth. So remember, if it's orbicularis, that means it's circular. So it's going to be a circular type of long, long muscle, as we know. If we were to split it, it will stretch out and be longer. And so that's going to be a circular muscle that's around our mouth. And usually when we have orbicularis, it's going to be around an opening. So we normally call them a sphincter as well. For some folks, that's going to be really easy. Like orbicularis oris, that means we're talking about the orifice, which is going to be the mouth when we're thinking of the head. Some folks will think about it that way as well. You also can kind of, again, use the origin and insertion. Your origin will have to be the maxilla and the mandible. And then again, your insertion is going to be the ability to close your mouth. So that's where that contraction is happening. So you can remember it that way as well. Let's go ahead and get into the app to see different ways that, or movement that these muscles can make. All right, here we have the temporalis muscle. How do I know where it's located? It's near the temporal bone of the skull, okay? Now, again, let's go ahead and see that movement. As you can see, it's going to be closing the jaw. Closing the jaw. So this has to be our insertion area, and this has to be our origin. Now let's get into our frontal belly or frontalis muscle. We see it's going to be at the top of the head here and around that brow ridge. So if you raise your eyebrow, you're going to be lifting your eyebrows up and again wrinkling your forehead using the frontalis muscle or the frontal belly. See how it's lifting up? See that again? See that it's lifting up. So I'm just showing you ways that you can start remembering some of the locations of these muscles. All right, here we see our masseter. Remember, the origin is going to be right there by the zygomatic arch and the zygomatic bone, and then we have the insertion by the mandible. Because remember, the mandible is going to be doing what? Providing that strong bite. So let's go ahead and see that movement. Okay? So you might be thinking, this is providing a strong bite, but the temporalis muscle was also going to be making sure that we can close our mouth. So yes, muscles work together to help us be able to do a certain movement, right? And chewing down is going to be something that, yes, both of those muscles can contribute to. Now let's look into the orbicularis oris. This is going to be our mouth here. Now, as you can see, we're closing the mouth. So when you close the mouth, what are we doing? Contracting. So our origins have to be on our maxilla and our mandible. And then in order for us to close this opening, that's what we're going to have the insertion there. So insertion to help us close that mouth. All right, folks, hopefully that was helpful to help you remember the location of these four muscles. Let's get into some more. Next muscle is going to be the muscle of the neck. Okay, so we have our head muscles. We have our head muscles. Now we're dealing to neck muscles. Okay, and that's going to be the sternocleidomastoid. So sternocleido means that we have the origin that's going to be at the sternum and part of the actual clavicle here. And if you wanted to get more technical, you'll say the medial clavicle. And then we have the insertion, which is going to be, again, the mastoid process behind the ear. Right behind the ear, that little bump behind the ear. Okay, that's going to be the insertion. Now, location of this, you can literally turn your neck to the left, turn your neck to the right, and just put your hands down the sternocleidomastoid. Okay, you could do it that way. Or let me just show you another way to show it for movement as well. All right, here's our sternocleidomastoid muscle. We'll see I'm turning the neck to the right. Turn the neck to the right. And you can even feel that. This is going to be one of those superficial muscles, meaning they do a big movement and it's easier to feel. So that could be a way that you can locate it. Also, just think neck, neck, neck. Now, it's not 100% on the neck. We also know that it's going to have an origin point on the sternum and the medial clavicle. But yes, we're saying that it's going to help our neck move. So just remember that location. You can also think of it by function. So the sternocleidomastoid is going to flex the neck, on both sides. It can help with rotation, and it can tilt your ear to your shoulder. So I'm tilting my ear to my shoulder. I'm rotating my head, and I'm turning from left to right. That's all going to be the action of the movement of the sternocleidomastoid. Now let's get into the next, which is going to be trapezius. So we already did all these. Now let's get into trapezius. So with the trapezius, we're talking about muscle that's going to be on the trunk, but not on the front of the trunk, on the back of the trunk. So as you can see, when you're thinking of the name trapezius, just like when you talk about sternocleidomastoid, we know that's all about origin and insertion, which is why you can focus on that. But trapezius is all about shape. And that means it's kind of shaped like a trapezoid. Not perfectly, but it kind of is. So here's our trapezius here. Okay? And it's sort of shaped like a trapezoid. They're not going to change the name now, so just keep that in mind. But you see how long that muscle is as far as like the length of it from your upper neck all the way down to the middle of your back. More specifically, you're seeing that you're going to have origins for this trapezius muscle at the occipital bone, going from the cervical all the way down to thoracic as far as your vertebrae goes. So that's very, very long. That's where that trapezoid portion, the wide portion of the trapezoid is coming from. Okay? And then the insertion of this would be on our lateral clavicle bone, or the spine of the scapula, or you can say the acromion. All those details. And remember, the goal is location, location, location. So on this cadaver, you'll see that you have this large muscle that's extending from that neck to the mid of the back, and that's going to be your trapezius muscle. Let's see this muscle move around. All right, let's see what it does. It's allowing the shoulders to shrug. You see that. What else might you think this might be able to do? Because it is attached to the neck in some kind of way. So let's think about what it can do for the neck. It has the ability to extend that upper neck as well. Because when you are shrugging, sure, we saw a muscle go up, right? But when you're depressing back down, you also can extend the neck. And so you might be saying the trapezius muscle is very big. So is it all just one piece? No, we do label it based on whether or not we have an upper, middle, and lower portion. For example, the upper portion has the ability to elevate. So you saw that we have that movement kind of go up, shrugging our shoulders. That upper part of the trapezius is going to help with that. The middle part is going to help retract everything back to its normal size. And then the lower part is going to help depress. So when we have to go back down, we shrug our shoulders and then we go back down, it's going to be that lower part, that's going to help with that depression of that movement, okay? So the upper is all about elevating, helping us elevate the scapula, for example, because we're moving the scapula. The lower part is going to be helping depress the scapula, and then the middle part is going to help with retraction. But again, if you're focused on location, which is going to be your job when you're studying this, and also for the lab practicums, you want to make sure you can think trapezius, huge muscle that's going to be on the back that has a trapezoid-like shape, okay? Then you'll be able to get your trapezius muscle. Let's move on. Now we're going to look at the trunk from the anterior view, which is going to help us understand our abdominal wall. Now, as you can see, we're going to be focused on the rectus abdominis, external oblique, and internal oblique. Now, rectus, we mean, remember we talked about it being straight fibers, abdominals, meaning abdominal wall. External, meaning it's going to be external or going to be on the outside, so it's probably more superficial. And then oblique means that we're dealing with fibers at an angle, okay? Internal means that it's probably going to be deep to the external obliques. And oblique means, again, we're going to have fibers at an angle. And because they're bolded, we have to make sure we're talking about the origin, we're talking about the insertion, we're talking about the action or function, and also the location of these particular muscles. Get them in details. We have our rectus abdominis, internal oblique, external oblique. Now, external means it's on the outside. So if you were to take away the first layer of skin, you will see your external oblique here. So that's what this one means here. Then, if you were to take another layer off, then you'll see your internal obliques and your rectus abdominis. So the internal oblique and rectus abdominis is deep to the external oblique. That means the ones that you're touching on first is going to be your external obliques. When you're looking at, touching around the muscles around your hips, that's going to be your external oblique. Okay, you have to go deeper to be able to see the rectus abdominis and internal oblique. Let's get into the rectus abdominis. Again, we see these fibers, they're way better to see here, are parallel or straight fibers. We see the origin is going to be the pubic crest down here. And then the insertion, you can also say the pubic crest or symphysis. The insertion is going to be up here at the sternum. So let's say we have our sternum up here. That's going to be our insertion. Now, not only does it insert at the sternum, it also inserts at some ribs. Okay, ribs 5 through 7. And these details will be in the next slide as well. So don't feel like you have to just write everything down right now. Just let's focus and try to just organize ourselves. Okay? So on the sternum itself, since it's at the bottom of the sternum, you can also just say xiphoid process if you want to add more details. Now, what's the location of this? Well, it's on the abdominal wall, so we know that's going to be a location. But it is deep, and you can also say it's a six-pack of the abdominal wall. Okay? You can keep that in mind as well. What can this allow you to do? So we're thinking, what is this function? What's the action behind it? Well, you can sit up with it. You can tilt your pelvis. You can compress the abs. Remember we were talking about flexion and moving the spine forward? That's going to be help of the rectus abdominis as well. All right, folks? So when we're talking about the abdomen, we're definitely talking about fiber direction. But also don't forget, superficial and deep can come in with these if possible as well. Let's go ahead and get into the internal obliques because, again, they're going to be seen in the same layer as the rectus abdominis. So the internal obliques are going to be deep angle fiber. Where are they deep to? They're deep to the external oblique. Okay. And when you're thinking about the origin of them, you can say, okay, well, it's going to be like our fascia, some kind of fascia. And so we're talking about some type of membrane. You also can say the iliac crest. Crest. True job. The iliac crest. So we can have an insertion at the, the origin at the iliac crest. You can also say the inguinal ligament. I mean, it's easier to think iliac crest for this one, okay? And then the insertion for it is going to be the pubic crest. So we have our pubic symphysis here, and then we're going to also have the pubic crest here. And so that's going to allow us to kind of go down a little bit further for the insertion and the origin when it comes to the internal oblique. You can also say it's going to be inserting at the bottom 3 to 4 ribs, because it doesn't just go down this way, it's kind of larger as well, so we can have the bottom 3 or 4 ribs that we also can have insertion points for that internal oblique. Okay? Now, what does it allow us to do? Well, rotate. We can rotate our trunk. We can cause flexion of the trunk, and of course, compress the abs. When we're talking about flexion, yes, we can bend forward. We also can bend laterally. We can bend side to side, to the left and right. Okay? And of course, that means we also can have rotation from the left into the right. So just keep those in mind as well. Finally, let's go to a more superficial layer to understand the external oblique. So again, that means we're dealing with angle fibers, and here's the external oblique here. This is the internal oblique. I'm trying to show you the origin and insertion of that. Here's the external oblique. This whole thing here on the outside. Okay, so more superficial. Now, when we're thinking of that, that means you got to ask yourself, where's going to be the origin for the external oblique? Well, the external oblique is going to be actually starting at the top here, where you see mostly ribs, the lower 8 ribs. So say you have the lower 8 ribs down here, and that's where you're going to have the overall origin for the external oblique. And guess what? They're going to go all the way down to the pubic crest or the iliac crest. You see here, cover that whole area. You can also say that the origin is just the outer surface of the 8 lower ribs, and then the insertion is going to be the line and the the line in the pubic crest or iliac crest. So we have that option. We have the pubic crest here, and then we also have the iliac crest, so you can kind of choose one of those as the insertion point. But remember, it's all going to help you do what? Locate it on an actual model. That's the whole goal here. The location is going to be important for these 3 muscles. Let's get into more details so we can understand that origin and insertion portion. So remember, we need to know the origin, the insertion, the action or the function, and the location for these 3 that are in bold. So let's focus on the external oblique. We see the laterally here. It's way easier to understand the origin points and insertion points. So again, these lower 8 ribs is where the origin point is going to be. And then we have that iliac crest, and of course the pubic crest as well, which is going to be our insertion point. What else do we see? Also have insertion at the linea alba. So it's going to be connective tissue from your sternum all the way down to your pubic area, okay? And that can be all the insertion points for the external oblique. Now, what's the goal? The insertion is supposed to get closer to the origin so that we can know that, hey, we're going to be flexing forward, so flexion, flexing to the side, left and right, rotating from left and right. That's all what the action of the external oblique can do. Now let's look at the rectus abdominis. Same thing here. Rectus abdominis, again, is going to be right there at have the origins right there at the pubic crest. Okay, so here's our origin for our rectus abdominis. This is what we're going to focus on first. And then we also see that it's going to the bottom of the sternum. That's where that xiphoid process is. And the costal cartilage of ribs 5 through 7. So now we're adding more details to our general picture that we had over here. So the costal cartilage is going to be the cartilage that's connecting directly to the sternum for these ribs. And as you can see, the rectus abdominis is going to have insertion areas over there. Again, if the insertion is supposed to get smaller and get closer to the origin, or sorry, the length is supposed to get smaller so the insertion can get closer to the origin, then again, you flex forward, that's what you do. Now this is all going to be about compressing the abs, tilting your pelvis up, for example. That can also, again, charge up your rectus abdominis muscle to contract. But no matter what, all of these muscles in the abdominis, so the rectus, the external and internal obliques, all of them are going to compress the abs. Because again, all of them are going to have that ability to have their origin points and their insertion points get smaller when they compress the abs. Okay? Next, let's go ahead and get into our transverse, I'm sorry, I'm tripping, internal oblique. I will talk a little bit about transverse later, but internal oblique, as you can see again, what's the origin of the internal oblique? It's going to be the lumbar fascia. So that's just going to be connective tissue in the lumbar here. That's going to be an origin point. What else did we say? We said the iliac crest. So again, more of an origin point. And then what else? The inguinal ligament. So we do have an inguinal ligament down here. The ligament in your groin area, for example. And that's going to also be an organ. Our insertion is going to be the linea alba. So again, it's going to be connected to that line going down from the sternum down to the pubic area. Insertion. Another insertion is going to be the pubic crest. So we have another insertion here. And then we have another insertion at the bottom for ribs. So as you can see, yes, we have the insertion origin, getting close to one another. But when you're doing that movement like rotation, flexion, or compressing the abs, you'll see contraction is going to happen there as well. Now I do want to add in the transverse abdominis here. Now the transverse abdominis we don't have to go into detail of because it's not even on our list. But these are going to be transverse fibers. As you can see, their origin is definitely going to be that lumbar fascia. We also can see that we are dealing with basically the surface of ribs 7 through 12. You can also see that as well. And some of the iliac crest. Okay, so more origin here, origin here. And we have the insertion here. We also have the insertion at the linea alba, which is going to be a line basically, and at the pubic crest. So again, the origin insertion is not too far from one another, but what is the whole purpose of this? To compress the abs. And so you can see it here. We have our skin. We know the external oblique is going to be the most superficial. Okay. Then we have our internal oblique and our rectus abdominis. It's going to be deep to the external oblique. And then deeper than that will be our transverse abdominis. And the whole goal of this is to help us be able to compress our abs. All right, folks? Now, on the next slide here, I have all of that origin, insertion, action / function, and location in all these areas. Okay? Now, let's get into a little bit more details about the location first. So, rectus abdominis is going to be our six-pack on the abdominal wall. That might be the easiest one to recognize. The external oblique is going to be on the outermost surface. So it's superficial, and it's also going to be in the lateral portion of the abdomen. Okay? So that means that the fiber is going to run downward, okay, immediately. So here's our fibers running downward that way. As you can see, it's on the lateral side of the abdomen. And then we have the internal oblique, which is going to be deep to the external oblique, and the fiber is going to run upward. So here's our internal oblique. Fibers are running upward. Distinguish external, internal. Yes, they're both on the lateral piece, but also you can distinguish them based on the way their fibers run. So if the fibers are running upward here, we know the origins have to be here and insertion has to be here. Here, the origin has to be here, insertion has to be here to be able to remember those details. Now, transverse. I doubt it's going to be on any of your exams, and it's not going to definitely be on the lecture exam because it's not a part of the list. But I just want to show you how, again, we have our fibers going crosswise, origin here, and then we have insertion here. So let's go ahead and see what this looks like, and we'll be taking off pieces of skin and then talking a little bit about movement. Here we have the skin. Now let's go ahead and remove that layer. And once we remove that layer, we can see the external obliques here. So again, you see the fibers going down. It can be our external obliques on our side. They're basically lateral to the abdomen itself. And again, that's what you see. So because it's superficial, we have to go and take another layer off to be able to see our other muscles. Let's go ahead and take another layer off. Now we can see our rectus abdominis, six-pack, and we can see our internal obliques with the fibers running up. See that? Right here, internal oblique over here as well. Okay? And if you take another layer, then you can go ahead and see the transverse abdominis. You can see that as well, but again, just want to show that. So when you're going ahead and trying to locate these on an actual model, for example, you need to make sure you're going from superficial, external oblique, take another layer off, which is deep to the external oblique, and you'll see the rectus abdominis and the internal oblique. All right, let's go ahead and see the rectus abdominis, in motion. We go, we see the flexion of the spine, have that movement there, also compressing the abs. Next, we're going to focus on both the internal and external abdominal oblique, okay? This is going to be flexing that spine forward, which we know both can do. Now let's see rotation using the same muscles. rotating left and rotating right. Now let's see compression of those abs. See how it's compressing forward. Okay? Now let's see it with skin, because sometimes that's going to be harder to see in this view. Let's see it with some skin on it. See, focus on this here. It's like when you're exhaling and your external internal obliques are kind of going toward that midline area. That's the muscles of the head, neck, and trunk that we're going to be focusing on. Hopefully you know where to get the location of these from. And again, for the rectus abdominis, external oblique, and internal oblique, again, you need to make sure you know the origin, insertion, action, which also means function, and the location. See you in the next video.